I am Rima Slim, and my main appointment is in human genetics. So as you know, diseases may affect may manifest at any time in our life. For instance, Alzheimer's disease manifests late in adulthood. Autism manifests in childhood. The disease we work on is called molar pregnancy, and it affects the first cell that forms a human being in the zygote. In a molar pregnancy, the embryo stops developing very early, but its placenta, which is the interface between the mother and the fetus, continues to grow and form a tumor that is usually benign, but can be also malignant. So when a patient is diagnosed, the patient is told that although you are pregnant, you have no embryo in your pregnancy, and you are at risk to have a malignant tumor. So it's basically a difficult disease. We looked at this disease from a genetic perspective by studying sisters in the same family who have this disease. The sad story of these sisters is that every time they try to have a pregnancy, the pregnancy leads to a mole, no embryo, and risk for malignancies. So we mapped the defective gene to chromosome 19 and then identified the causative gene that is mutated in these patients. The gene is called NLRP7, and it is now a major gene for this condition. The next step was to understand the mechanism of this disease, which is like building a puzzle, basically, and whose pieces have to be added one by one. Now, we don't know everything about this disease, but we do know many things. An important fact is that NLRP7 protein is part of the oocyte cytoskeleton. These women who have recurrent moles are tested for this gene, and those with mutations are advised to receive ovum donation. The protein is in the oocyte cytoskeleton. Women who have these mutations in this gene, they produce oocytes that are able to fertilize normally, but in the embryo, embryonic tissues fail to differentiate, and the embryo stops developing very early. Our goals are to find additional genes for recurrent moles and other forms of fetal loss and help the patients. The most important part of our work is our trainees, because they are the ones who bring the pieces of the puzzle. I thank my trainee, and I thank you for your attention.